Hello, I am Dr. Stephanie Lipnicki. This is the Natural Alternatives podcast, formerly known as the Practical Medicine Podcast. If you've been here before, I'm still the same me, still practicing acupuncture, still focusing on my goal of acupuncture world domination. I wanted to continue sharing information about health and wellness with people. So, if you're totally new, I am an acupuncturist. I started out as a massage therapist when I was in my late teens, early 20s. I knew that I wanted to be an acupuncturist. My practice focuses on three main areas: a lot of gynecological conditions. I also focus on cosmetic skincare aspects of things, and I actually do a lot of work on emotional well-being. But being that I practice in New Jersey and there are not a lot of acupuncturists in New Jersey, I treat everyone from pediatrics to, every age pretty much. I'm a whiz at treating back pain because I started out as a massage therapist. Pretty much any kind of back pain, not like lower back pain, upper back pain, neck, shoulder pain, all of those things. A question that I get asked a lot is whether or not acupuncturists have to be trained. We do. My background is that I have a bachelor's in nutritional science and then a combined bachelor's master's in acupuncture. And then I have my doctorate in acupuncture. And again, I was a massage therapist for almost 20 years. I also have my skincare license. And I try and incorporate as many different ways as I can to get people on the path to wellness. During the pandemic, I got certified in hypnotherapy and hypnosomatic acupuncture. I love incorporating that for a number of conditions. It's great for anxiety, lowering pain levels. It's also great for insomnia and a number of other things. And the combination of the two is just fantastic. And I got into acupuncture because my instructor at the massage school was an acupuncturist, and I just absolutely fell in love with it. So my goal is to maybe recover some of the topics that were covered before in a new light, to have lots of guests come in and talk about different specialties, be it acupuncturists, other people who practice different modalities, and to share those things to help people get on the path. We work well with Western practitioners. I always tell people not to discredit what their Western practitioner has said. People tend to get a lot better quicker if they're doing both. A lot of times people come into my clinic and we're, kind of the last resort. I've tried everything and it hasn't worked. So I kind of feel like acupuncture should be the first resort for most people, and then you wouldn't have to try a number of other things, but it definitely is a last resort for a lot of people. One of the things that differentiates acupuncture is we work more on a wellness modality versus once you've already gotten super sick, which is different from Western care in that you usually don't go to see your doctor other than your annual. You'll go when you're sick. We prefer to catch things ahead of time. People will ask me, well, why would I come to you if there's nothing wrong? And it's so that you don't end up having something go wrong in your life. Some of the misconceptions about how acupuncture works, it's not a one visit sort of thing. If I could make people feel great in just one visit, not that it's never happened, but it normally doesn't, I would probably charge $1,000 a treatment and just vacation the rest of the week and only see a few people. And it also depends on what other things people are doing to get on the path to wellness. If somebody has had something for 10 years and they're seeing me for the first time, it could take me 10 months to get them back on track versus somebody who threw their back out 2 weeks ago probably only needs to see me for a month, and then they're back on track, and maybe they'll come just because they realize how amazing they feel when they've been getting acupuncture done. Another thing that is a misconception is that acupuncture is just putting pins in people. There are other modalities that go with it. Not every acupuncturist is trained in herbal medicine. I did train in both. So for some patients, I want them to be on herbs. Herbs are sort of like the homework that they need to do when they're at home. I incorporate cupping, which was sort of made famous during the Olympics when a lot of the swimmers had cupping marks. It just feels wonderful. I sort of try and describe it as massage in reverse, where massage is your hand pushing into a muscle. Cupping uses suction to pull the muscle and the tissues below away to improve circulation. I've done it on pediatric cases for coughing. It breaks up phlegm. It just feels really good. Most people don't think it feels good because sometimes it can leave bruise marks, but it actually feels quite wonderful. Another technique that I use a lot is called gua sha. It takes a flat-edged tool and you use it to scrape along the muscles. Again, it improves circulation. In this case, it's pushing into the muscles. The tissue tends to get very red, almost looking like a rug burn if it's done properly. And each time you do that, it usually does get less and less red as it breaks up adhesions that are in the muscles that are, there's less circulation in that area, and it just needs to improve. I do, in terms of the cosmetic stuff that I do, I am Meizen cosmetic acupuncture trained for over 10 years, I think, probably longer. And that involves using tinier, smaller needles than I even put into body points on the face for a series of treatments. And it's done to alleviate lines and wrinkles. It's not going to make you look like you had a complete facelift surgically, but it will only soften fine lines and wrinkles, firm up the skin. Your complexion gets clearer. It helps with acne. And just because you're needling the entire body, you're getting well from that visit as well. It's not just the pins that are in the face. In addition to that, I'm trained in micro and nano needling, which is another way of smoothing fine lines and wrinkles. Although this is not Asian medicine related, I'm also fibroblast skin tightening trained. I did that over the last year. So that gives a little bit more of a lift when you do that technique. It's a little bit more involved. There's a little more downtime with that. Couple of days that you have a little bit of redness, some swelling of the face, but in terms of comparing it to surgical cosmetic procedures, there's not as much downtime. No bruising, and then of course there's the risk of dying if you have surgery, so there's no risk of that when you do the cosmetic acupuncture, microneedling, or fibroblast skin tightening. And then in terms of emotional things that I treat, a lot of anxiety. Patients come in and have other things wrong, or patients come in thinking one thing is going on and something completely different comes up as they start to let go of some of their stress and tension. So I just wanted to come on today and do a little brief introduction. I am going to start putting together a whole bunch of fun and exciting things and get those on the schedule for the next couple of weeks. In the meantime, you can visit my website, which is Natural Alternatives with an S, centerforwellness.com. I have online scheduling. You can read more about my practice. And then my Instagram account is Natural Alternatives Center. Facebook is also Natural Alternatives Center, and you can follow me on all those different places. If you have topics that you would like me to present, please reach out because I would love to cover things that people want to hear more about. and I hope to see you back here. Take care and be well. The contents presented during the Natural Alternatives podcast include information about various modalities that exist to achieve health and wellness and are for informational purposes only. You acknowledge and agree that the following disclaimers and warnings shall apply to all content presented. The podcast contains the opinions of Dr. Stephanie Lipnicki, DACM, LAC, and the guests of the show. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you have regarding any medical condition. The views expressed in the Natural Alternatives podcast are our own and do not represent those of all licensed acupuncture professionals. Always seek the help of your own acupuncturist or medical provider to determine your best course of care. You may want to use the information presented as a supplement to better understand your diagnosis or treatment, but it should not be the sole thing that you use to make important medical decisions. Do not use the content of the podcast in lieu of medical advice. Never disregard professional medical advice or delay seeking care because of something you have heard on this podcast. Privacy is important to us. Thus, all people, places, and scenarios have been changed where applicable to protect privacy and maintain confidentiality.